Hello, everybody. So I propose to discuss a little bit about the question of positive mental health. I have no disclosure for this talk. Of course, if we discuss about positive mental health, we have to speak a couple of minutes about happiness. And in fact, it is very difficult to define what is happiness. It is much more easy to define when you suffer or when you are painful, but to define what is happiness, it is difficult. You can read the chapter of the Stanford Encyclopedia of Philosophy about philosophy of happiness, and you will see that in fact there are three main theories of happiness. The first one is about hedonism, pleasure. When I eat a cake, I am happy. Okay, why not? There is another theory about happiness, which is related to emotional state. When I am joyful, I am happy. You could say, well, pleasure is close to a positive emotion. So these two theories are a little bit redundant. Not at all. When you eat a cake, you can feel guilty. And guiltiness is a negative emotion. So in fact, we have here two different sorts of things. The third one is very different. It is satisfaction with life. That is fulfillment of a need. And fulfillment of a need is not necessarily correlated to pleasure or positive emotion. For the Olympic Games, for instance, you have seen athletes who were satisfied because they had a medal, but they had suffered during their whole life with training to obtain this satisfaction. And so you see, according to what you decide for your life, the notion of happiness can vary a lot. Nevertheless, it has been considered for long that the object by many philosophers that the look for happiness was something very important for the life of a human being. Now we enter in the core of the subject. Why this question of positive mental health and happiness, etc., in the field of psychiatry? Because, in fact, to be honest, of course, psychiatrists are physicians and they are dealing with people who are sick, they are ill. And you have seen that with time, physicians have been fascinated by disease. Just look at the fascination for the differences between DSM-4 and DSM-5, and it took hours of discussion, while in fact it is not so important. Anyway, we are obsessed by disease, by technology of medicine, and so medicine becomes more the diagnosis and treatment of disease instead of the discipline that treats patients. And I have been surprised to see that in the main English dictionary and the French dictionary of the Academy of Medicine, the definition of medicine is the art to treat and diagnose disease and not to treat patients. So obviously there is a problem, and for this reason, after the Second World War, there has been an opening of concept with the notion of health, mental health, and positive psychology, and this is fine. But what people perhaps do not know is that these new concepts have also some limitation. I am going to come back to something that you all know, I am sure, the definition, the historical definition of health proposed by WHO in 1946. A state of complete physical, mental, and social well-being. Okay. This could seem perfect. One day, one of my colleagues told me, okay, but you see this definition, this is crazy. You can be that only after an orgasm or a shoot of heroin. And this is the reason why in 2015 WHO added a little part to this definition. To reach a state of complete physical, mental, and social well-being, an individual or a group must be able to identify and to realize aspirations, to satisfy needs, and to change or cope with the environment. Okay, so if you read carefully these two sentences, in fact, there is a contradiction. A satisfaction of a need, when you satisfy a need, you are quiet, you are peaceful. And this is exactly the opposite of a complete physical, mental, and social well-being. When you look at after the definition of mental health, this is very curious. Definition of mental health by WHO, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to her or his community. Few people know this definition, and I think this is shocking. This is shocking to consider that mental health, in a way, has for objective to work productively. At least this is questionable. But anyway, you will see another point, that mental health is a state of well-being. And so, what is the difference between health and mental health? And why there is a notion of productivity, etc., for mental health and not for health? Anyway, why not? And after, it comes the notion of positive psychology, which is a little bit in the same field. Scientific study of positive human functioning and flourishing on multiple levels that includes the biological, personal, relational, institutional, cultural, and global dimension of life. So you see, positive psychology, as opposed to health and mental health, is rooted in science from the very beginning. And indeed, positive psychology has led to very interesting research and findings. And for instance, in teaching, positive teaching, there are many ways to deal in a classroom with positive psychology, which has led to progress in the way teacher can deal with kids. Indeed. So there are indeed some good things with positive psychology, and even there has been some randomized controlled trials to evaluate positive psychological approach to deal with some distress. So there are some good things, but anyway, positive psychology relies on an opposition of things that should be by essence positive and things that should be by essence negative. While in fact this is not so simple, Sometimes, classically anger, sadness, impulsivity are supposed to be bad. But sometimes you need to be in anger. You need to be sad to show to other people that you need them. Even impulsivity, which is horrible for our modern societies. But behind impulsivity, you have also spontaneity. And it is so valuable to have people who are spontaneous. And at the opposite, when you live with somebody who is joyful every day, this is boring. This is very difficult because you cannot be down when you are with somebody who is always up. So we need, in fact, a tension, and this life is good when there is such a tension between positive and negative emotion. Anyway, most often we prefer to be up than down. But now we have to enter to the field of medicine and psychiatry. Positive psychology, we want to make people happy, but is it the objective of medicine to make people happy? And the answer is no. The objective of medicine is not to make people happy. The objective of medicine is to deal with suffering. And of course, when you put suffering apart, people feel better, but not necessarily happy. And you know that sometimes even when a human being has a severe disease, his life becomes better because he's realized that his life is valuable. So, first, I think this is very important to notice that we are not devoted to ensure happiness. Our mission is to treat patients. Who could say to me, but what is the definition of patient? The definition of a patient is somebody who calls for a doctor. This is the definition of a patient. He is ringing to your bell. He asks for some help because he suffers. You could tell me for psychiatry and child and adolescent psychiatry, this is a little bit more tricky. When you are schizophrenic or anorexia nervosa, you will not say, I need your help. Okay. But most of the time, this is the case. And even with anorexia nervosa, even with schizophrenia, when you take time to discuss, in fact, they want some help. In fact. And a very important point about that, remember that in psychiatry, we made many mistakes in wanting to make people happy despite themselves. Remember about homosexuality during the middle of the 20th century, or the political issues in Russia. You know, psychiatrists dealt with opponent or political opponent, and indeed they consider that these guys were crazy, but they didn't realize that they were crazy. When people don't realize that they are crazy, first you have to consider that they are not crazy. This is my conclusion. Indeed, physicians and psychiatrists are obsessed by symptom and disease, and positive psychology has been something good to challenge ourselves, to think different, and to be honest, during clinical practice, to use positive psychology tricks. This can be very helpful. Okay. But we have to remember that a solid societal legitimacy is required to be allowed to determine what is good for people. And healthcare providers do not have this legitimacy more than other people. We are just equal to other people. And this is particularly true in the field of psychiatry. Thank you for your attention.